Hi, my name is Mike Russo, and I'm a concerned citizen that feels if people understood when and how the signed healthcare reform bill will affect them, they would feel much better about the bill. This presentation is based on a memo from Nancy Ann DeParle, Director of White House Office of Health Reform. The original memo was based on what coverage is provided. I reorganized the information into a timeline that presents what benefits to expect this year, next year, and beyond. Please sit back and enjoy the presentation. I think you'll be pleasantly surprised. Healthcare Reform 2010, 2011, and beyond. This year, children with pre-existing conditions can no longer be denied health insurance coverage. Once the new health insurance exchanges begin in the coming years, pre-existing condition discrimination will become a thing of the past for everyone. Healthcare plans will allow young people to remain on their parents' insurance policy up until their 26th birthday. Insurance companies will be banned from dropping people from coverage when they get sick, and they will be banned from implementing lifetime caps on coverage. Restrictive annual limits on coverage will be banned for certain plans. Americans will be ensured access to the care they need. Adults who are uninsured because of pre-existing conditions will have access to affordable insurance through a temporary subsidized high-risk pool. An independent commission will be established to advise on how to best build the healthcare workforce and increase the number of nurses, doctors, and other professionals to meet our country's needs. A new independent appeals process will be created that ensures consumers in new private plans have access to an effective process to appeal decisions made by their insurer. Discrimination based on salary will be outlawed. New group health plans will be prohibited from establishing any eligibility rules for health care coverage that discriminate in favor of higher wage employees. Funding will be provided to states to help establish offices of health insurance consumer assistance. The office will help individuals in the process of filing complaints or appeals against insurance companies. Small businesses that choose to offer coverage will begin to receive tax credits of up to 35% of premiums to help make employee coverage more affordable. Small businesses that choose to offer coverage will begin to receive tax credits of up to 35% of premiums to help make employee coverage more affordable. New private plans will be required to provide free preventive care, no co-payments, and no deductibles for preventive services. Help for early retirees will be provided by creating a temporary reinsurance program to help offset the cost of expensive premiums for employers and retirees aged 55 to 64. The Medicare Part D donut hole will start to close by providing a $250 rebate to Medicare beneficiaries who hit the gap in prescription drug coverage. And in the next fiscal year, the bill increases funding for community health centers so they can treat nearly double the number of patients over the next 5 years. Going forward, a $1.5 billion in funding will be provided to support the next generation of doctors, nurses, and other primary care practitioners, on top of a $500 million investment from the American Recovery and Reinvestment Act. Starting January 1, 2011, insurers in the individual and small group markets will be required to spend 80% of their premium dollars on medical services. Insurers in the large group market will be required to spend 85% of their premium dollars on medical services. Any insurers who don't meet those thresholds will be required to provide rebates to their policyholders. This bill helps states require insurance companies to submit justification for requested premium increases. Any company with excessive or unjustified premium increases may not be able to participate in the new health insurance exchanges. Medicare will be required to provide free preventive care, no co-payments, and no deductibles for preventive services. And last but not least, beginning in 2011, the bill institutes a 50% discount on prescription drugs for Medicare Part D donut hole beneficiaries. I hope you were pleasantly surprised by what the healthcare plan has to offer, and I hope you now understand the timeline. Thank you for watching this. I'm Mike Russo.